8:15, it is WWL. It is Medicare's annual enrollment period. A friend of mine lives down the street, is older, and became eligible for Medicare. Dr. Brent Wallis joins us now, Chief Medical Officer at People's Health. I suggested he call either People's Health or go to the center, but he insisted that I try to make him understand it, Dr. B, and I swear to goodness, I would rather have a tooth pulled without anesthesia than try to explain this. It can get kind of complicated, can't it?
Yeah, definitely. There's a lot to consider.
Well, Medicare's annual enrollment period starts in just 2 days. And if you want to change your Medicare coverage for 2023, this is the time to do so. Dr. Brent Wallis, is here to help us discuss the annual enrollment period and your Medicare plan options. So, Dr. B, what is the annual enrollment period?
Sure, Tommy. Yeah, we'll see if we can kind of tear through all this. So the Medicare Annual Enrollment Period, or we call it AEP, is a time of year that starts actually on October 15th, so this Saturday, and it runs until December 7th, so about 7.5 weeks or so long. And it's the period of time where anyone who's eligible for Medicare can make any changes to the coverage that they have. So what you can get in your health plan from year to year actually changes. A lot of the benefits change. Sometimes the cost for things change. And so every year this is the time where you really want to review what your coverage is and make sure that you have what you need for the year to come.
If you do have Medicare, is this the only time of year you can make changes?
Typically it is. So typically annual enrollment is when you sit down, you look at what's going on and you make your changes. There are a few exceptions to the rule. So in particular, like you were mentioning, somebody who's just turning 65, they've got a special enrollment period that actually can last from about 6 months before they turn 65 to 6 months after. And then if you've got Medicare and Medicaid, there are some different rules that we won't talk about today, but they have a little bit different time period they can change. And another situation would be is if you move out of the area. So if you move to an area where your plan's no longer available, then obviously you can enroll in a different plan. And the last situation would be is if you want to switch from your plan into a 5-star plan, you can do that. But in general, I tell people don't miss this deadline. Take this as an opportunity to see what your coverage is and what you really need.
How do you know what changes your current plan might be making for 2023?
So, this is really important, and it gets confusing, but your Medicare health plan should have already sent you something called an annual notice of change. And you get a lot of mail sometimes, and it looks like junk mail. This is something you want to actually open and you want to read, because what it's going to tell you is everything that is changing in the plan that you're currently in. Now, all those changes will be effective on January 1st. So in addition to that annual notice of change, you're going to receive something called an evidence of coverage. That document actually lists everything that your plan covers, what all your costs are going to be, and really what all the benefits will be for the upcoming year. So what you want to do is sit down with those two documents, and I do this with my mom every year. I ask her where her notice of change is. We sit down, we look through it, and we kind of say, okay, what's changing, what's not changing? Does this still cover what your needs are? It's going to really tell you, is the premium going up or down? Are your deductibles changing? And how much money may you have to pay for the year to come?
So this is coming from their Medicare plan provider? I don't want people to throw away something they think is junk mail.
Yeah, no, this will come from your current Medicare health plan. So if you are enrolled in a health plan right now, you will get this. In fact, you should have already received it, so make sure you don't throw it out.
So it would come from People's Health if you're enrolled in People's Health?
Yes, that's
Gotcha.
Correct.
All right. Do you have to change your Medicare coverage every year?
No, you definitely don't. It's important to review what changes are happening, but if you're happy with what's going on and the changes don't look like they're going to affect you, then you'll automatically remain a member of that plan unless you choose to switch to a new one.
I will take a break. We come back. We'll talk about what changes you can make to your coverage during the annual enrollment period. And a quick reminder, WWL, is going to be out at the People's Health Medicare Center in Metairie at Vets and Causeway from 6 a.m. until 4 p.m. broadcasting live. So we'd love for you to come on over and stop by. It kicks off, as you know, the Medicare Enrollment Period October 15th, but we're going to be there next Tuesday all day, starting with me, ending with Scoot, and we're looking forward to it from 6 a.m. until 4 p.m., so you can stop by and get every bit of information you need. 8:20, time for traffic now on WWL. 8:25, quickly back to Dr. B, Chief Medical Officer of People's Health, talking about Medicare enrollment, which begins on Saturday, the enrollment period. Doctor, what changes can you make to your coverage during that annual enrollment period?
Yeah, so there's several things you can change during this period. If you're currently on original Medicare and probably have a standalone prescription drug plan or a Part D plan, then you can actually switch to a new prescription drug plan. Or if you never signed up for one, you can choose one now. The other big thing you can do from original Medicare is you can enroll in a Medicare Advantage plan. And then if you're already on a Medicare Advantage plan during this time is when you can switch to a different Medicare Advantage plan, or you can return to original Medicare and then choose a prescription drug plan.
What's the difference between original Medicare and Medicare Advantage?
Yeah, so there's a lot of differences, but in particular, original Medicare covers a portion of all your health care needs, but it doesn't cover certain things. Like, for instance, routine dental or vision care is not covered. Prescription drug coverage is not included as well. You actually have to choose a different plan for that. So that's why a lot of people choose a Medicare Advantage plan. It's a little bit simpler, kind of all-in-one type of plan. They usually include a lot of extra benefits, things like fitness center membership. They definitely cover dental, vision, and hearing. Some cover transportation as well. And most of them include that prescription drug plan as well.
So how do you know what's right for you or your mom or your dad, or in this case, the neighbor down the street for me?
Yeah, it really is individual, and so that's why it's important to take this time of year to really decide what do you need, compare what you get under original Medicare to Medicare Advantage or to other types of insurance. The first thing I always look at is cost. You got to stay within a budget. You know what is probably going to happen with you over the course of the year, so you want to look at deductibles and premiums and figure out what your out is going to be. And then you really need to look at coverage. Does it cover what you need? If you're already seeing certain types of doctors, are they in that network, that plan's network? So you continue seeing the doctors that you want to see? And are your drugs covered as well? And then the other thing would be those additional benefits. Do you need them? Do you need dental care? Do you need vision care? Maybe hearing aids? Would you enjoy a fitness membership? So if those are important to you, you want to look at plans that cover that. And then the last thing you really want to consider is something called the star rating. So each year, Medicare issues a star rating to each Medicare Advantage plan, and it's looking at several categories, but in particular, how the members, the people who are in that plan, how their experience is with the plan, how the customer service is, and how the health of those individuals is. So a higher star rating means a higher quality plan and higher levels of satisfaction.
Sometimes buyer's remorse happens. What happens if somebody signs up for a Medicare Advantage plan and they don't like it?
Yeah, it absolutely does, and so because of that, there's something called the open enrollment period, which begins on January 1st, and it runs all the way until March 31st. So that's your buyer's remorse, where if you signed up for a plan that you decide you don't like, you've got the option to either switch back to original Medicare, or you can actually switch to a different Medicare Advantage plan.
This is complicated stuff, so how can people find out more about People's Health plans?
Yeah, it really can be complex, and you want to have a good question and answer session. So, I encourage people to come and see us at the Medicare Center in Metairie, right next to Party City. You can sit down with one of our representatives and actually answer all of these questions and ask anything that, that may be coming up. It's really, we have a mix of virtual and in-person presentations as well. You can go to our website at peopleshealth.com/meetings, and it'll give you a list of locations and times. But those are really informative and kind of fun to attend.
And if you call, you'll tell them where the meetings are, right? 844-600-7910?
Absolutely. Give us a call.
And we're looking forward to it, Dr. B. I don't know if I've ever met you in person or not, but WWL and People's Health teaming up for an event this Tuesday, October 18th. We're going to be broadcasting live from the People's Health Medicare Center all day, talking about all things Medicare. and Medicare Advantage. We'll even have a special segment with Dr. B. I don't know, is that going to be with me or not? Doc, do you know?
Yeah, I think it's with you. I'm looking forward to it, although it will not be at 6 a.m.
No,
it's
no,
a
no,
little
no,
bit later than that.
No, that's for me. I get up at 6, not you. But you can listen live or visit the Medicare Center in person to participate. We're really looking forward to it. Thank you, Doc.
All right, see you Tuesday.
All right, you can find out more about People's Health at peopleshealth.com. You can call 1-800-978-9765. And, of course, you can always follow People's Health on Facebook, Twitter, and Instagram. 8:31, a minute late. Time for WWL First News. And for that, we go to Ian Ozan.